So today I'm talking to those of you who were recently diagnosed with cancer, and you may be thinking to yourself, what if I don't want chemotherapy? Now, that's a valid question, and that's a question that I have heard a lot in the years that I've been practicing oncology. And I get it. When you think about chemotherapy, you hear about all of the side effects and the bad experiences that people have had with chemotherapy. They tell you that they've been sick, that, this was the worst part of cancer treatment. And of course, you remember that because people generally don't share the great things that happen during treatment. They tend to reminisce about the bad experiences that they had. So, of course, if that's all you're hearing, of course, you don't want chemotherapy, and I get it. Nobody wants chemotherapy. I didn't want chemotherapy when I was diagnosed with cancer. I thought that I was going to have a real easy go of it. And when I found out I had to have chemotherapy, that really kind of changed my whole psyche around my cancer treatment. But if someone has recommended that you get chemotherapy, they're recommending it because the data that has been studied with patients with diagnosis similar to yours, they have recommended chemotherapy because those patients have gotten a better outcome with getting chemotherapy. Now, that being said, are there people that have bad experiences from chemotherapy? Absolutely. But there are also people who have very little side effects when it comes to chemotherapy, and they get through treatment just fine. But are you going to be one of those people? We don't know. But one of the things that I tell clients when they express that they don't want to get chemotherapy, first reason I ask is why. And the most common answer that I get is that, I don't want to kill my good cells too, because doesn't chemotherapy kill good cells too? Yes. The way chemotherapy works is that it does kill the cancer cells, but in killing the cancer cells, it also can kill some of your good cells. But when we think about the risk versus the benefit of receiving the chemotherapy versus the toxicity or the side effects that the chemotherapy causes, there's always greater benefit to giving you the chemotherapy because side effects from chemotherapy most often are temporary. So the benefits of you getting a cure of your cancer is greater than side effects from the therapy, which typically are temporary. So that is the reason why that I would recommend that you proceed with chemotherapy. But if you're still setting your mind that chemotherapy isn't something that you want to do because you may be Christian and you feel like, God is going to cure me. He has told me I'm going to be healed. I have prayed for my healing. I am not going to get chemotherapy. I want you to consider this, that in the Bible, Jesus healed people in a lot of different ways. There were a lot of different ways that Jesus healed. He used his voice. He spoke healing. He touched people. Some people touched him. There were a lot of different ways that he healed people. And a lot of people are praying for a miracle for their cancer, but the miracle that God may be sending to you may be the team of people that he put around you. Your cancer may be requiring several modes of therapy, several types of miracles to be performed. And those miracles could be the touch from surgery. It could be the chemotherapy. It could be the physicians, the team of physicians that he's put around you to support you during your treatment. And sometimes we think that food is the answer, is the cure of your chemotherapy for your cancer. But food can be a healing mechanism. But when you've got cancer that is large enough to be diagnosed and seen on imaging, or that has spread, when it gets to that size, food is not a cure for cancer. Food can be an adjuvant therapy used along with other therapies for cure, or food can be a preventative strategy to boost the immune system to prevent recurrence or to prevent a cancer from occurring But once you have a cancer, food in and of itself, by itself, is not a cure. You need something else. And chemotherapy may be one of those things that has been recommended for you. Now, I always say that when chemotherapy is recommended, the benefit from getting it is higher than the side effect profile. And you can always stop a treatment that has been started if you find that the side effects are too high or the toxicity is too great. But you will never know if a treatment was going to work if you never try. So the last thing that you want to happen is for your cancer to come back and you wonder in the back of your mind, well, if I had gotten that chemotherapy, would my cancer have come back? No, you don't want to ever second guess yourself, because the best time to cure cancer is the first time. Because when a cancer comes back, there is no guarantee that a cancer will come back in a form that is curable. So you want to take every opportunity to cure your cancer the first time. So again, if you're Christian and you're feeling like you don't want to get chemotherapy because God is going to perform a miracle, he's going to cure your cancer without chemotherapy, I want you to think about this, because I heard my pastor say this one time, and it hit me, uh, in a way, because I was never able to answer this question when a Christian would say that to me, that they didn't want to get the treatment because they were waiting on a miracle. But when he said this, it gave me clarity in how to answer this question, because he said a miracle is something that you can't do for yourself. And when you're diagnosed with cancer and God puts a team of people around you with a recommendation and a plan to cure your cancer, that is your miracle. He's not going to swoop in and perform a miracle when you haven't done everything that you can do to cure your cancer. That team of people, those are the people that have been placed in your life to perform that miracle. He has anointed those hands. Now, if there is someone on your team that you do not vibe with, that you don't get a good feeling about, or you disagree with the recommendations, by all means, get a second opinion. That's what they're for. Your doctor's not going to get mad at you for getting a second opinion, because more than anything, as your caregivers, we want you to be comfortable and have clarity and understand the treatment recommendation that has been recommended for you. I got 3 different opinions regarding my chemotherapy, because it's not always cut and dry. So don't be afraid to, seek a second or even a third opinion, or just to seek a different personality, because that person that you initially consulted with wasn't someone whose personality or bedside manner that you vibed with. So by all means, get another opinion. Take your healthcare in your own hands in that way. But I would say that before you decide to forego chemotherapy, that you, one, hear the recommendations, ask the questions why, and then think to yourself, do I want to be in this seat again, getting cancer treatment again, if my cancer comes back because I did not get the recommended therapy? Now, you not getting in the chemotherapy is not a 100% guarantee that your cancer will come back. And your getting chemotherapy is not a 100% guarantee that your cancer won't come back. So there are no guarantees, but you want to put yourself in the best possible circumstances to make sure that your cancer doesn't come back, because the last thing that you want to do is go through cancer treatment a second time, because all of the treatment options that were available to you weren't explored during that first course of treatment. So hopefully this answered your question. If you know someone who might benefit from this, please share this with them. I'll be back again with more tips for you. I'm Dr. Tonya, your sister in the journey. I'm here to help you create a lifestyle so that you can live healthy longer.